Mhm.
Hi, I'm Laura Johnson, and I'm one of the founding members of the Career Experts Group, a consortium of master career practitioners, personal branding strategists, and diversity, equity, and inclusion consultants. We share one mission: to guide and support individuals at all stages of their career journeys, from new college graduates to C-suite executives. Each month, we publish an information-packed newsletter called Your Career, Your Future, where we provide the latest career and hiring trends, insights, tips, tricks to help you find your next job, climb the next rung in your career ladder, or get the most out of your current position. For our October newsletter, we're focusing on career transition and again, looking at the trends and tips, readiness, rebranding. With healthcare being a key component of career transition, we've invited Denise Bitler, owner of Resume Interview Success, LLC, to help clarify the questions we typically have when we're trying to choose the best health plan for ourselves and for our families. Denise brings more than 30 years of HR experience, specifically in employee benefits. In addition to being a self-described benefits geek, and I love that, Denise is a master resume writer, a LinkedIn social media strategist, and a certified interview coach. So welcome, Denise. Thank you for joining us today.
Thank you so much for having me, Laura. This is a topic that is near and dear to my heart. And, for 30 years, I lived and breathed benefits as a director of benefits. So I know that this can be a very confusing area for a lot of people.
Yeah, I'm excited. I'm so fortunate. I think that we have your wealth of experience and knowledge. So we appreciate you being here.
Thank you.
So my first question is around the ACA. There's been a lot of confusion over the years, misinformation around the ACA healthcare mandate. What's the current policy there?
All right. So the full name is the Patient Protection and Affordable Care Act. But most people refer to it as the Affordable Care Act, ACA, or some people negatively refer to it as Obamacare. The three main goals of the original act were really to make insurance affordable by providing lower income households, those with incomes between 100% and 400% of the federal poverty level, with subsidies to offset the cost of health insurance that it's now provided through the federal marketplace. The other intent was to expand Medicaid programs to cover adults. And the intent was to cover adults that fall below 138% of the federal poverty level. The problem with this part was this is part of the ACA regulations. However, it was left up to each state as to whether they would expand their Medicaid eligibility limits. And there were a number of states that unfortunately did not. And then the last piece was really to implement an innovative medical care delivery method designed to lower costs by really helping everybody become more conscious and informed healthcare users. The original ACA healthcare mandate, which was part of the ACA policy, required all individuals to have health insurance or they'd have to pay a tax penalty. I don't know whether you remember, but in 2019, that part of the ACA regulations were eliminated. And, you have proponents and opponents of ACA, but it doesn't matter which side you're on, there were some key parts to ACA that are still in place and they were so desperately needed. Prior to ACA, people could be denied coverage, people could be charged excessive amounts of coverage, people could have certain conditions carved out of their insurance plans if they had a pre-existing condition. I knew a friend of my husband's worked for a company. She'd been there for a number of years. She had a son who had a very rare medical condition, and she hated her job, but she couldn't change because of her son's medical condition and the fact that there was a very good chance that none of it would have been covered if she changed to a new employer, new insurance. So with the passing of ACA, insurance carriers can no longer deny coverage or charge more for somebody that has a pre-existing health condition. They can't limit the benefits for that condition. And once you have the insurance, they can't refuse to cover treatment for the pre-existing conditions. The other thing that the ACA did was previously insurance companies usually employers would set their plans up, or insurance companies would set it up that your dependent was dropped from insurance when they turned 19 or age 23 if they were a full-time student. What ACA did was it allowed parents to keep their children on their insurance up until their 26th birthday, regardless of whether or not they were a full-time student or anything like that. So again, that was another big one. And then one was prior to ACA, medical plans had limits. They had lifetime limits, they had annual limits. And if you had cancer, if you had a catastrophic event, you could hit your lifetime limit and then you have no benefits. They will pay nothing after that. So what the ACA did was it says for the 12 essential health benefits. So this is things like emergency care, prescription drugs, lab services, things like that. No medical plan can set an annual or a lifetime limit on the benefit, on the amount of coverage. And then the last piece was the implementation of coverage of certain preventive services for children, men, and women being covered at 100%. Because, as a director of benefits, it used to frustrate me, the premiums, the costs would continue to go up. You can only cost shift to employees so often. You have to start addressing the cause of the claims. And the way to do that is by getting your preventive coverage, getting all your preventive services done, getting your employees and their spouses and their children to get their preventive services done. So now with ACA, when you have insurance, those preventive services are covered at 100% at no cost to you. So there's no excuse not to get your preventive screenings. So now I'm off my soapbox.
That's good to know. And I didn't know about the lifetime limits. And that is really good to know because, yeah, you're right. People with certain conditions would hit those ceilings pretty quickly. And then what do you do?
Exactly.
So there are a lot of things that have come out of this and I think, as you said earlier, making people more aware of their healthcare, instead of just.
Exactly. People don't know you can potentially negotiate. Most of the carriers now have things on their website where you can go in, if you have to have a test done, you can go in, you can put in the test, and it will give you the average pricing for different locations near you, whether it's done at a hospital, a standalone facility, a doctor's office, whatever. And people just think the cost is the cost, and that's not the case. The cost will vary dramatically based on where you have it done. So if you're paying a percentage of the cost, obviously it's in your best interest to do the homework and find where you can get it done for a lower cost, because then the cost to you is going to be lower.
Right. Wow, good point. And speaking of cost, so some people choose HMOs because they think that they're cheaper, they can be cheaper. But so if I join my company and I choose an HMO, and then I decide, no, I want a PPO, how long do I have to wait to make that change?
All right. So, and some people don't understand why there are timing restrictions, but when you're when you're paying for medical benefits, especially through an employer, through payroll deductions, you're paying for them on a pre-tax basis. And because of that, the law restricts when you can make benefit elections or changes. And again, you're getting a tax break, paying it on a pre-tax basis. So they don't want people to be able to, adverse selection, things like that. So it's restricted to when you can do it. Employees can elect or change coverage when they first become eligible, during their annual open enrollment period, or if they have a qualifying life event. So a qualifying life event is really a change in your situation. Getting married, having a baby, losing health coverage. that can make you eligible for a special enrollment period. The special enrollment period allows you to enroll in your health insurance outside of the yearly annual open enrollment period. One thing people don't necessarily know, and it's extremely important, is when you're making your benefit selection, whether it's when you're first eligible, whether it's, during open enrollment, or whether it's when you have a qualifying life event, there is a time restriction on how long you have to make that change. All right. It's usually set by the employer. It's part of their plan documents. The general rule that I've seen any place I've worked and most other companies that I'm aware of, it's usually a 30-day rule, meaning you have to make a change. If you're going to make a change, you have to do it within 30 days of the date of the event. So 30 days from the date of your benefits eligibility when you're first eligible, or 30 days from the date of a qualifying life event. There's 4 main categories of qualifying life events. The first one is related to loss of coverage. So it could be, you lose your job, you lose your coverage. Your spouse was on their own insurance. They lost their job, so they lost their insurance. So you need to put them on yours. Your child who's under 26 was on their own. They lost their job. They come on it. If somebody was on Medicare, Medicaid, CHIP, and they lose that coverage, that's a qualifying life event that would allow the employee to do a special enrollment. If a child turns 26 and they lose coverage through their parents' plan, that child's working, that would be a qualifying life event for them at their employer to get on that coverage. Other things are, changes in the household, getting married, divorced, having a baby, or adopting a child. Or what a lot of people don't know is if a child is placed with you for, now my brain's not working on the word. Sorry about this. When a child's placed, foster care. So if a foster child is placed with you, you may be able to add that child to your insurance.
Okay.
If there's a death in the family. If you have an HMO, which HMOs only have in-network and they have certain, it's more local networks. Well, if you move to a different zip code or county, you have a student, you cover a student and they're moving to school and that's not in the HMO, it's not in the HMO network. Those are the types of things that that could be considered qualifying life events. And the other one is, say your income dropped. So, say they cut your hours and it still allowed you were considered full-time, because full-time is average 30 hours or more per week, but you were paying for a higher priced plan and now you don't have as much income. That could be a qualifying life event. So there's many qualifying life events. The biggest takeaway on this is, remember, you have to do it within 30 days.
Okay, good to know. It feels simple that it's 30 days for everything, no matter what it is, and not, different things for different issues. So good. Thank you for that.
Just remembering it. It's just remembering that you have that limit.
Right. And so on the subject of enrolling, so I suppose I enroll in my company's plan, and then my husband or my spouse gets this great opportunity and they have great coverage. So should I enroll in their plan as well to get more coverage?
So you need to be very careful. When you're covered under more than one health plan, so you're covered under yours and your spouse's, there's a thing called coordination of benefits that have certain rules that come into play. So the coordination of benefits it's used with group health plans to eliminate duplication of benefits. So years ago, I'm not going to tell you how far back because then you'll know my age. There was no coordination of benefits. So if you were covered under 2 plans, you could in effect be reimbursed for more than 100% of what the cost was. So with the coordination of benefits, they're usually set up so that one plan would not pay any more than it would have had it been the primary insurance. So I'll give you 2 examples. So if your primary insurance pays 80% of a claim. And then the secondary, so your husband's insurance normally only pays 80% of a claim. Then that secondary insurance is not going to pay anything because they won't pay more than they would have paid had they been primary. The primary pays 80, the secondary pays 80. So there's nothing for the secondary to pay. You look at another example, if your primary insurance only pays 70% and the secondary insurance normally pays 80% of that type of claim, then your primary would pay 70 and then the secondary, your husband's, would pay 10%. Okay. So before you even consider spending the money to be covered under both plans, you need to compare both plans, see exactly how they work, see whether or not it's possible to drop your insurance completely and go on your husband's. Does your husband's have any surcharges or anything for spouses? So you really need to do your homework and do your math before you would follow through on something like that.
Well, that's really good to know, because again, you think more is better, but not necessarily. It doesn't necessarily make a difference.
Exactly.
Again, so how do I know which plan is best?
All right. So it's very difficult. So there's a couple things that you need to think about. The first is you need to think about the type of plan and the provider network. Okay. So does the plan provide in-network benefits and out-of-network coverage? Does it matter if they don't offer out-of-network coverage? Okay. Maybe you don't travel a lot. Maybe their in-network coverage has all of the doctors and hospitals and everything that you normally would use. Okay. Are your current providers in the network? Does the plan cover the medications you take, both generic and brand? Will you be required to select a primary care physician and obtain referrals to see a specialist? Is that a problem for you? Do you see a lot of specialists and you want to be able to just go and see who you want to see? Do you travel a lot, potentially need access to non-emergency medical care? So we've people down here in Florida that the snowbirds, they come down and they're down here for, from November till March. And, if they have an HMO where they live in New York, that HMO is not going to cover them for anything other than emergency care down here. And what you consider emergency care and what the insurance company considers emergency care might be two entirely different things. So those are the kind of things you need to think about. Do you need out-of-network coverage? How big is the network? Do you need referrals? Are certain medications covered? Really looking at those questions and then kind of doing a side-by-side comparison. Most companies on their benefits website and stuff will allow you to, if they have multiple plans, they'll allow you to compare, and be able to do like side-by-side comparisons and really pay attention to those. Too many times people just focus on the premiums or the payroll contributions. They don't think about, okay, what are my out-of-pocket expenses going to be? What's the deductible on each of them? What is my out-of-pocket maximum? Okay. How much do I have to pay before the plan starts paying anything? Am I more comfortable just having copays for the majority of my things? So, a PPO plan, you're going to have copays. You're going to have a copay for your doctor's visit. You're going to have a copay for your medicine, copay usually for, blood work or whatever. Other plans, point of service plans, EPO, the exclusive provider ones, a lot of those, you have to pay everything in full, or there's certain things you have to pay your full deductible on before the plan starts paying. Okay.
Right.
So, and then again, do you, or your family, if they'll be covered, have medical conditions that require ongoing doctor's visits, tests, prescriptions, things like that? Do you expect an upcoming medical situation or procedure, pregnancy, knee replacement, planning on having a child next year? And then the last thing really is the prescription coverage. Some plans will have a limited formulary. Other plans have an open formulary. So it's really important, if there is medication that you take, especially if you're required to take a brand versus a generic, absolutely check the formulary first.
Yeah, you really do have to, you have to partner with your benefits
Mhm.
person
Yes.
in your organization. Really take the time to sit down and use their knowledge, because
Yes,
there's so much to think about.
it is. And unless you do this for a living, it can get very confusing because there are so many moving pieces.
Right, right. Awesome. Lastly, a lot of people are concerned about confidentiality, and especially when it comes to our health. Can you explain first the differences in those spending and savings accounts that the employers might offer, and then talk about whether an employer can see how we spend that money, what we spend that money on or not?
Okay. So first off, there's 4 different types of spending and savings accounts that an employer can offer. The first that I think most people are used to is a flexible spending account, or FSA. Okay. With this one, with a flexible spending account, it allows you to elect to put money away pre-tax that you can use for medical, dental, vision expenses. Okay. One of the nice things about a flexible spending account is whatever you sign up for the year, that money is available in your FSA account day one of the plan year. So if your plan year starts January 1st and you signed up for $2,500, as of January 1st, you haven't contributed anything out of your paycheck, but yet that entire $2,500 is available in your FSA for you to start spending. Okay.
Mhm.
So you spend it, and then, you could spend it all in the first month, not have anything left to spend, but you're going to be contributing to that FSA for the entire year. But
Okay.
again, it allows you to have that money available at the beginning of the year. This is very helpful for some people that, have maybe big prescription things, or, the beginning of the year, you start all over with your deductible and stuff. So having that money kind of fronted to you can be very, very helpful. There's also, if you've heard it, it's a limited purpose flexible spending account. So for those people who take a high deductible plan, okay, with a high deductible plan, some companies will allow you to contribute to a health savings account. All right, the health savings account, which I'll get into in a second, the health savings account, if you're enrolled in a high deductible plan and have a health savings account, you can't have a flexible spending account.
Hmm.
But some companies will offer what's called a limited purpose flexible spending account, or vision and dental expenses. And then it can be used for regular qualified medical expenses after you've met your deductible. Okay. So it really depends on the rules that the employer has set up. But again, back to the health savings account, when you're in a high deductible plan, you can contribute to a health savings account. Sometimes your employer may contribute money to it as well. One of the nice things about a health savings account is the health savings account, you own it. So whatever you put in, that's your money. That money never goes away. If your employer contributes to it, once it hits your account, that's your money. It doesn't go away. So if you change from a high deductible the next year and can no longer contribute, or you change jobs, that HSA money is yours forever until you spend it. Whereas with the flexible spending account, because the company is fronting the money to you, the FSA is a use it or lose it. So even though you put money in, if you don't use up all that money by either the end of the plan year, or sometimes there's a 2-month grace period, you lose that money.
Hmm.
Okay, so the FSA is a use it or lose it. The HSA is a true savings account. You own it, you keep it, it's yours forever. There's also, lastly, an HRA, which is a health reimbursement account. There's not a whole lot of companies that do this, but a health reimbursement account is an account that companies donate money to or put money in. You cannot contribute to it. Only an employer can. They own that money. Okay. You don't pay taxes on any money that they give you for the HRA. They decide whether to let unused funds roll over. They decide if you if you have to use, like if you have an FSA, if you have to use the FSA first. So there's a lot of rules that the employer sets with the HRA. But again, you don't own that money. And then lastly, to your point about, confidentiality, most companies, almost every company that I'm even aware of, will usually contract with an outside vendor to manage their spending or savings account programs. This outside vendor does have access to what you spent the money on. They have to, because it's their responsibility by law to make sure that you're only using that money for eligible expenses as decided by the IRS. And they have to know what you've spent it on. However, the employer will only get notification and reports on the amount you spent. They will not be informed in any way of what you spent the money on. So from a confidentiality standpoint, you do not have to worry about your employer knowing what you spent your money on, or if you have a medical condition or whatever.
Yeah, good to know. Wow.
Mhm.
I really have enjoyed this today, Denise, and it makes me think that we probably should do quarterly calls just on benefits, because there's so much to them, and I'm sure they change regularly too. So keeping up to date on what's new and what's changed, and what policies have changed. I think we could do this quarterly, so we should
Yes.
we should certainly do this again. I really wanted to thank you for sharing all this helpful information. And for our listeners, Denise has created a comprehensive document titled "Understanding Your Health Insurance Options," and that can be found on the the Career Experts Group website, which is at www.careerexpertsgroup.com. And once you get to the website, click on the More button, and that More button will open a drop-down list. Go to Resources, and there you're going to find the information pack document that you can either read online, or you can download, read, and save for later as well. So thank you again, Denise, and thank you all for listening to our program today.
Thank you, everybody.